My name is Rob Tufel, and I am the Executive Director of the Scleroderma Research Foundation. And I'm here today with Robert Riggs, who's the Executive Director of the Scleroderma Foundation. I'm the Executive Director of the Scleroderma Research Foundation. Robert Riggs is the Executive Director of the Scleroderma Foundation, and Maureen Sauvé is the past president of both Scleroderma Canada and the Scleroderma Society of Ontario, as well as someone who's living with scleroderma. And just as patients partner with their healthcare teams, scleroderma patients partner with their healthcare teams to determine the best treatment outcome, our organizations are also collaborating together so we can provide the best information and support to the scleroderma community during this pandemic. And I think I speak for all our organizations when I say that scleroderma patients and their families are at the core of everything we do. And we encourage you to contact our organizations at any time to get more information. We also will be planning more webinars throughout the month, so please stay tuned. We're working together, and I want to thank my colleagues who have been incredibly collaborative and have really stepped forward. We've all stepped forward to be able to respond to this disease. I would like to start now by introducing Dr. Tracy Frech and thank her for volunteering her time. We contacted her last Friday. We said, "Can you do this?" She was like, "I'm on it." You can imagine how busy she is right now, but we are so fortunate to have Dr. Frech. She's the director of the Systemic Sclerosis Clinic at the University of Utah Hospital. She's also the director of clinical trials for the Division of Rheumatology, and her research interests include vascular aspects of autoimmune disease. She's participated in many clinical trials and has published articles in medical journals. And what is pretty amazing about Dr. Frech is that she's both a researcher and a highly skilled clinician, which is an incredibly important combination now as she works with other clinicians to determine the best care for scleroderma patients during this pandemic. Before we get started, just some housekeeping. If you see at the bottom of your screen, you should see a Q&A. You can write your questions at any time during the presentation, but Dr. Frech will take the questions at the end. Robert Riggs and Maureen Sauvé, who have worked in the community for so many years and have an incredible wealth of knowledge about scleroderma, will be facilitating those questions. We obviously can't answer all 500 questions, but they will be facilitating the questions and making sure we get the answers to the issues that are impacting the scleroderma community right now. So without further ado, I know everybody is eager to hear Dr. Frech. Thank you again, and I will turn it over to Dr. Frech for her presentation.
Thank you so very much for the invitation. This is a real honor to speak to our community. I was incredibly moved this past year at the Idaho Scleroderma Foundation meeting when Dee Berlisle, who's the organizer of that meeting, spoke to the group and said, sharing information in our community is a real blessing because our lives are enriched by our scleroderma family. And I think that's really important in times like this, where there's a lot of information about the pandemic, that we remember that we're a family and that giving good information to each other is imperative. I will be mentioning, can you see my screen here? Perfect. I will be mentioning some commercial products in the talk, mostly in the discussion of immunosuppression. I have no financial disclosures or commercial relationships with these companies, but I think it's important to discuss drugs that you may be on so that we can keep everybody well. So the objectives that I'd like to cover today is to talk as a community how we can best manage information. I'd also like to give you some tips that I think are important for taking control, particularly when we're dealing with a pandemic where there's a lot of unknowns. We'll discuss the importance of healthy eating, stress management, and exercise, because those are imperative for staying well. So the first part of managing information is making sure if you're looking up a resource, if it applies to your specific situation. And I think that's really challenging because there's a lot of different recommendations out there, and some of them are posted by nurses and doctors, so they seem like they're very credible. But I just remind you that you should always talk to your physician if you're not sure, if you've looked up information, if it applies to you. because I do believe during this pandemic, everybody's trying to do their best to put information out there, but how you interpret that information is critical for keeping you well. There is information out there that applies to everyone, and we'll touch a bit on each of these. The first is the real value of hand washing, not touching your face, and how to clean surfaces, how you can self-monitor your particular symptoms, and how you can best hold your immunosuppression if you have a fever or a known COVID contact. We'll discuss the principles of social distancing and how you can personally explore with your healthcare providers if there's telehealth options to get you answers to your questions without having to go into the clinical office or emergency department. So let's talk a little bit about viral transmission, because I think this is particularly hard because the information does seem to change a bit every day. There are statements on all the major websites that say there is a concern for immunocompromised people and folks that are pregnant. However, those recommendations right now are just mostly precautionary. The things we do know from the data that's become available are that people older than 65 years old or folks with asthma should be the most cautious. And those two recommendations are based looking at the evidence-based literature that's come in from many countries that have hit their peak for COVID-19. However, there are some things that are very important for you to know about the virus. The main thing is it's spread mainly from person to person. And I know that's really concerning because all of us have close contacts with our family members. But a close contact is defined as someone who has 6 feet of distance with, or is within 6 feet of distance or 2 meters of you. And the reason this is important is because the main way the virus transmits is through respiratory droplets that are produced when an infected person coughs or sneezes. And a sneeze, of course, can come on without a person preparing for that. So the best way to be in preparation is to be far enough away that that sneeze would likely not reach you. And the reason is the main way the virus is acquired is if those droplets land on your mouth or nose or are inhaled into the lung. It is thought that people are the most contagious when they are the most symptomatic or the sickest. And that's particularly important for you if you have visitors coming to your home, that you make sure that you have contact with them by phone prior to them coming in contact with you to make sure they don't have any symptoms of COVID-19. However, there's also information out there that shows a spread can be possible before a person shows symptoms. But I like to reassure our population that this is not thought to be the main way the virus spreads. Additionally, there is data that shows there can be spread from contact with contaminated surfaces or objects. And as you know, this information has changed a bit from the major websites, how long the virus can live on a contacted surface, and there's also what temperatures it's ideally it is killed at. However, I think it's important to realize, putting that contaminated surface into perspective. If you touch a contaminated surface, it is then you touching your own mouth, nose, or eyes that's important. So even if you've touched a surface and you're not sure who's touched that, you can get rid of the virus by good hand washing. And I'd like to also highlight that this is not thought to be the main way the virus spreads. And I think this is important because patients have had lots of questions of, what if I have groceries delivered to my doorstep? Do I have to leave them out there on the doorstep for a minimum of 3 days before I can touch them? So again, if you've touched a contaminated surface, the next step is hand washing. Well, let's discuss hand washing because it is something that a lot of us probably didn't do well prior to the COVID-19 outbreak. And so shown here is it's a 13-step process that should take 40 to 60 seconds. And the actual vigorous scrubbing of soap all over your fingers and getting in between your fingers and rubbing your thumb and wrist, that process should take 20 seconds at least. And so oftentimes you sing happy birthday, that takes about 20 seconds, and you can make sure you've spent the adequate time to rub all those surfaces of your hand. After you finish completely covering and scrubbing your hands and you wash your hands completely with water, make sure you're turning off the faucet with your elbow. And then you're using a single-use towel to dry your hands completely. Reusing a towel during this epidemic is not recommended, so single-use towels that are thrown away is preferable, particularly if you've had known contact with a surface that may have been contaminated. What about alcohol-based hand sanitizer? So this is important to realize that all hand sanitizers need at least 60% alcohol to be effective. What this means is that if you have a hand sanitizer at home that smells really good, you should turn over the back of the product label and ensure that it's effective to kill viruses. The process is important as well. You want to get that gel product onto the palm of your hand and rub your hands together vigorously in between your hands, around the thumbs and wrists, and then let that gel dry, and your hands should be sanitized for around 20 seconds before you start the drying process. But I'd like to point out, particularly because there's a big national shortage on alcohol-based hand sanitizers, most of the epidemiologic studies that were done were used to show its effectiveness with hand washing. And I'm going to show you a picture of that here. So shown over to your left is the concentration of a certain type of virus. And they looked at the probability of infection before and after. And it was shown to be most effective for reducing the concentration of a virus by first vigorously hand washing and then using hand sanitizer. So again, I don't want folks to be discouraged if you haven't been able to get hand sanitizer into your home. It's still the best thing we have available to us is a good hand wash. Additionally, it's difficult to know how vigorously you need to clean your surfaces and your items. And for this, I really think that the CDC has done a nice job of giving us options for investigating how to both make hand sanitizer, but more importantly, if you're using a hand sanitizer in your home, if the Environmental Protection Agency has registered that item so that you know it has efficacy against COVID-19. Additionally, it's important to realize that daily cleaning and disinfecting of high-touch surfaces in your home, particularly if you live in a household with many people that are coming in and out of your house, that tables, backyard chairs, doorknobs, light switches, remotes, handles, desks, and toilets and sinks should be cleaned daily in order to reduce transmission. It's important that you're wearing disposable gloves when you're cleaning and disinfecting your surfaces. And in particularly, it's important if you have a household member with you, if you can have someone who's not one of the high-risk categories perform this service for you. Make sure you remove your gloves and discard them after each cleaning. And for clothing, you should make sure you're laundering your items on the warmest appropriate water setting, and dry your items completely before you're in contact with them. And while the CDC does not endorse any specific products, there is a website list that can help you see if that product has gone through the Environmental Protective Agency's approval for trying to ensure that those products can kill a virus. And again, these tips on this slide in particular are just mostly to empower you so you know where to go get good information. And again, the CDC websites and the Environmental Protection Agency spend a lot of time researching and doing credible testing to ensure they can get you the best possible information. But that really leads us to the most perhaps challenging concept that has come into play during this COVID-19 pandemic. And this is social distancing. And when we are asked to social distance, it's to limit that close contact with other humans, mainly in a 6 feet distance, so that if you accidentally get sneezed or coughed upon, that does not directly come into contact with you. But there's some other things that we can do to reduce exposure, and that's including reducing unnecessary trips out of the house. If you have the ability to get a list of 3 to 5 people that can help you do trips out of the house for you, that can be particularly useful to social distance. And the reason the recommendation is 3 to 5 people is if there's only one person on your list and they start to feel ill, we really don't want them to continue to come into contact with you. In particularly, in folks that are having to use public transportation, we would recommend reducing use of public transportation and get letters from your doctor to help get you into a situation where you're not using public transportation to get to work. And this is mainly because gatherings of more than 10 people have been shown to spread the virus quicker. If you do need to leave the house, try to maintain that safe distance of at least 6 feet or 2 meters from other people. And there was a nice article published on this website at our university that really took the fear out of social distancing, so I liked that. It talked really more about this just being our civic duty, because everybody manifests symptoms differently, and some people are affected and others don't have any symptoms at all. So what we can do by reducing our unnecessary trips out of the house is not only protection of ourselves, but protection of others. But that really leads us to the idea of taking control during this pandemic. And I think that's been the hardest part of all the information that's coming at us from the media, is we want to, of course, do our civic duty, but we also need to try to maintain a normal as possible life. And the best way to do this is to establish ways to communicate with others. So regular contact with your loved ones, family, friends, and co-workers is essential for staying well. Importantly, if you find that the media is really causing you stress, identify a person to keep you updated. So if there is someone in your life that can watch the news for you and give you a recap at the end of the day of essential things you need to know, that can really reduce your stress level and help you maintain that normalcy in your daily routine. Identify that person also who can help you pick up your medications, food, and other essentials. And like we said, having a list of 3 to 5 people can be particularly important or helpful. Also look at your options on how to get food delivered, if possible, to your home. That will for sure reduce the amount of contact you're having with strangers. You should establish plans to telework, and that's important because your doctors really can help you here. They can provide you a letter that mandates this. Also know what to do if your child gets ill, if there are folks that can watch your child so that you can maintain that 6 feet distance. And also, I think this is an important concept of how to adapt to the cancellation of important life events, because that's also been very hard to stay well when things that are important to you get canceled. So how you can best maintain contact with the family, friends, coworkers, or whoever was sharing that special event with you to make sure that you still are getting the benefit of that human contact and the benefits of talking to someone who understands what you're going through. And that's really an important thing that I've learned during this pandemic, is that communicating things that have helped you with our scleroderma community is essential. And I was particularly touched. I had several people who reached out to me after they saw the flyer for this talk and told me things that they felt were helpful for them. They wanted to share that with others. And I can't tell you how meaningful I think that is, that our community cares about one another in that way. So what if you do have a contact with a COVID patient or person who might have COVID? And so important to realize what the term contact means. This is by the CDC, is that's being within 6 feet or 2 meters of a COVID case for a prolonged period. And remember, that can occur while you're caring for someone you're living with, you're visiting, or you're sharing a healthcare waiting area with someone. And so the first step of social distancing is trying to avoid as many contacts as you can. This also is if you've had a direct contact with an infection secretion of a COVID-19 case. And this is probably the most calls we get, is someone's been coughed on and that person then contacts them and says, I've tested positive for COVID-19. And so the first step, if either of these situations have occurred, is self-observation. And that means you're staying alert for subjective fever, cough, or difficulty breathing. And I think that's particularly hard too for our patients, is because oftentimes people will send loved ones to go get a thermometer in the home and they can't find one. And so a fever is if you have a temperature over 100.4 Fahrenheit or 37.8 Celsius. And if you don't have a temperature at home, but if you start to feel hot, then you really want to start looking for other symptoms such as a new cough or difficulty breathing. For our lung disease patients, that would be an increase in difficulty breathing during that self-observation period, which should be for 14 days. If you have a fever, you should self-isolate, limit contact with others, and make sure you're keeping in communication with your healthcare provider. If you develop emergency warning signs, you need to get attention immediately. And that's difficulty breathing with shortness of breath, persistent pain or pressure in your chest, new confusion or inability to arouse, or if your lips and face are looking bluish. And again, the key in this situation is if you've had a known contact and you have subjective fever and these symptoms, then getting early medical attention can help you. But I think it's particularly important to stress that other emergency symptoms still need to be assessed in the emergency department. And if you're having refractory nausea and vomiting and you have concerns for dehydration, you need to be assessed. Seizures or convulsions, if you're having chest pain or tightness suggesting of a heart attack that's not related to fever or COVID-19 concerns, broken bones, wounds that may need a stitch, or symptoms of a stroke, these are still emergency situations that need to be addressed in the emergency department. I think that's particularly concerning because right now nobody wants to leave their house and go to a waiting area that may have COVID-19 cases. But by calling your healthcare provider or 911, you can particularly protect yourself so that when you arrive at the emergency department, you have all the precautions in place so that you do not acquire COVID-19. And the reason this is so important is every time you have an emergency symptoms, immediate vital signs, intravenous fluids, urgent imaging, and specific life-saving medications can really help you. And so I really want to stress that still emergencies do occur. But particularly scleroderma patients, I think this is an opportunity for us to take control of potential systemic sclerosis emergencies that may occur. And this again gets you into the empowering part of making sure you have a plan in place that you can use if any of these situations occur. And that can include scleroderma renal crisis, critical digital ischemia, and we'll talk about fever on immunosuppression. The first step of taking control is asking if your rheumatologist has tele-rheumatology options. And so rather than waiting until there's an emergency, you can empower yourself by knowing of how you can best get your answers to your questions addressed during this pandemic. You can call and ask, does your rheumatologist or primary care provider have clinical video conferencing options and or e-consults where they can get answers to you without you having to leave your home. And it's interesting, but back in 2011, telehealth was really touted as a great way to improve safety and therapy adherence and identify patients who can taper immunosuppression. So a lot of rheumatologists may already have these systems up and running so that you can get these particular questions answered. Specific to the emergencies that we just mentioned, early recognition, diagnosis, and treatment of potential medical issues can be addressed by telehealth as long as they're not the emergency issues that require you to call 911. So let's talk about scleroderma renal crisis. And I think this is particularly challenging because of all the media blasts that are coming through. They can be very upsetting. And as you know, we recommend patients check their blood pressure when they're relaxed, they've taken some deep breaths, and they're at rest for 5 minutes. And in a time where there's a lot of anxiety and a lot of stress, it's hard to know if your blood pressure is elevated because you're stressed out or whether your blood pressure is elevated and needs to be addressed by your healthcare professional. So the important step of monitoring your blood pressure is getting a blood pressure cuff and realizing that you should do your best job of relaxation prior to taking the first measurement. Ideally, if you've already kept a log prior to the pandemic, then you know where your blood pressure runs for the most part. But if your blood pressure is over 140 over 90, or there's a rise of 30 or over 20 of your normal pressure reads, you're going to want to relax and then repeat it in 5 minutes. If your blood pressure still remains elevated, ideally you've already contacted your provider as part of your proactive management plan, and you know where you have standing laboratories. because what your provider would recommend if your blood pressure is remaining elevated, that you get some basic laboratories to ensure that this is not evidence of scleroderma renal crisis. And if you have a lab near your home that has the standing lab orders, you can know to get those laboratories, and then you can talk with your physician and say, my blood pressures remain persistently elevated and my laboratories are abnormal. Also, part of that proactive plan is to know, are you at risk for scleroderma renal crisis? And those risk factors most traditionally are if you have diffuse skin involvement, so that means involvement in your upper arms, thighs, and abdomen, if you're in the first 5 years of your disease, if your autoantibody for scleroderma is an RNA polymerase III, or if your doctor has told you you're at risk for renal crisis because you're on steroids. Those are all the conversations that you can have with your doctor prior to going to get laboratories. But in most cases, if your blood pressure is elevated, regardless of what type of scleroderma you have, your doctor is going to recommend those laboratories. So it's important to have those standing orders. Once you talk to your doctor about your lab results, they may recommend that you start an ACE inhibitor, and you do that at home. And it's really important to realize that prompt recognition of scleroderma renal crisis and initiation of an ACE inhibitor offers the best opportunity for a good outcome. So again, if you're able to start the medication, monitor your blood pressure at home, follow your labs near home in a laboratory setting, then you may be spared having to go into the emergency department. Additionally, I'll note that perhaps your blood pressure elevation may not be due to a scleroderma renal crisis, but good blood pressure management is important for all of our health. So you could talk to your primary care provider about other changes to blood pressure medications, particularly if you're finding your blood pressure is running very elevated during this information that's keeping you quite stressed out. I'll point out, though, that it may be that even if you had a good proactive plan with your provider, you still may be referred to the emergency department for attention for hypertensive crisis. And this is because an echocardiogram or electrocardiogram can give us information if there's heart involvement, if you're having a new severe headache or altered mental status, that would need to be monitored, and your blood pressure would need to be brought down very safely in an observation, in a closer observation setting. Or if you've had vision changes, your provider may want you to see an ophthalmologist. But again, I just want to highlight having that plan in place prior to having a scleroderma renal crisis can sometimes give you peace or a sense of control over a potential thing that could happen during this pandemic. Similarly, if you're noticing that stress is causing your Raynaud's to get quite a bit worse, you're having a lot more episodes, then you can talk to your doctor through the tele-rheumatology option or the e-consult to get your Raynaud's better managed, because a sustained Raynaud's event can lead to a black fingertip, and then that, which is termed critical digital ischemia, becomes that medical emergency. But again, if we can restore blood flow to the fingers with oral vasodilator therapies at the safety of your own home, that is ideal. If, however, the Raynaud's gets really very severe, I think it's important for folks to realize your fear of COVID-19 should not keep you away to get the proper assessment of this condition, because imaging can help evaluate if there's inflammation of a blood vessel or a blood clot that can require specialized management. And those specialized assessments can include having a rheumatologist consult with a hand surgeon or a vascular surgeon and admitting you to the hospital so that's observed closely, and also to look to ensure that there's not any infections so that an antibiotic is not necessary. But that really brings us to the most common question that we're getting, is what to do with immunosuppression during this pandemic. And again, getting back to the importance of a proactive approach with your provider is talking to your physician about why you're on immunosuppression can be really helpful for you to make decisions. So if you're on immunosuppression for skin thickening, interstitial lung disease, inflammatory muscle disease, or inflammatory arthritis, those are all conditions that could potentially flare just stopping the medication. So you really want to ask your physician why you're taking immunosuppression, whether you've been very stable on that immunosuppression, prior to holding the medication during the pandemic. And this is a really important conversation amongst a lot of the rheumatologists all over the world, is there's not a single answer to this. It's a really personalized decision with you and your physician to make sure you're taking the right amount of medication for a certain condition and you understand how you're taking that medication. However, another question you could have and discuss with your physician is, if you've been taking immunosuppression, you've likely had your blood test your blood tested regularly, and that's most oftenly done to make sure that your blood counts are not affected. You can ask your physician if your last monitoring lab had a low white blood cell count, because that's your infection fighting cell count. So if you're on a very high dose of immunosuppression, even if your disease has been very active, you can ask whether it's reasonable to reduce the medication so that your white blood cell count is normal, so that you potentially have the more of an ability to fight off an infection if it were to occur. But I do want to highlight, all physicians are agreeing, if you're taking an immunosuppressant agent and you develop a fever, you should stop that medication and call your physician for guidance. And I really highlight because sometimes physicians are getting behind on phone calls, and I wouldn't want there to be a 24, 48-hour delay and you can continue to take your immunosuppression while your fever gets worse. And the reason that is that fever is signaling that you have an infection, and the immunosuppression is preventing you from fighting off that infection. And that the provider may recommend laboratory work or imaging so that they can get a better idea of what's causing that fever. So why would we all debate and say, you know, everyone shouldn't just stop their immunosuppression? And why is this an individualized treatment decision? And this is because cytokines, which are the molecules in your bloodstream that signify you have inflammation, are associated both with infections and autoimmune diseases. So one of the reasons we use immunosuppression in autoimmune disease patients is to reduce those cytokines that are in your bloodstream that they're telling us that your body is attacking itself for no good reason. However, there was an article that came out of China that said the predictors of fatality in COVID-19 cases suggested that mortality was being driven by virally induced hyperinflammation. So these same molecules that are elevated in connective tissue disease patients without infection were, when they looked at all COVID-19 patients, the same molecules that predicted bad outcome. And so it's really, again, important for you to discuss with your physician whether you should continue that immunosuppression. You may be thinking, well, I'm not sure if I'm on an immunosuppressive therapy. And so I've listed them here so that you have a quick list to look at the most common medications that are used for skin thickening, interstitial lung disease, inflammatory myositis, and inflammatory arthritis. I've bolded the ones that are most commonly used for skin and lung so that you can look quickly at your med list. And I've also italicized 2 medications and put a star by them, because while these are not traditionally thought as immunosuppressive therapies, they are antifibrotic therapies that may impair the immune system. So again, if you're on these drugs, the next step for you to do is to talk to your physician why you're taking them, how stable you've been on this therapy, can your dose be reduced, and talk with them with your particular plan if you were to develop a fever on these medications. I also highlight here that there may be some medications that you're taking that are immunomodulatory drugs that are thought to be safe during COVID. The first is intravenous immunoglobulin, and this is an infusion. So of course, anytime there's a needle that's taken from the outside and put through your skin, there's always a risk of infection. But if you're not actively receiving the intravenous immunoglobulin during this pandemic and you've already received it, one of the questions we've received a lot is, could I have been protected from getting the COVID-19? Because this pools immunoglobulins. Unfortunately, since this is a virus that the world hasn't seen, the thought is that it doesn't provide you any protection against COVID-19, but likely is safe and didn't cause you any harm. Additionally, the 2 medications, of course, that have come up quite a bit in the media is hydroxychloroquine and chloroquine. because these medications have been regularly used for autoimmune disease. And the way they work in autoimmune disease is they change the pH or the acidity of the cell so that your cell works better in turnover. However, it also has shown that this medications change that acidity of the cell so that the coronavirus may not enter the cell as well. And so there's, of course, a lot of concerns about the shortages that may be seen with these medications for our autoimmune disease patients. I do point out, because a lot of folks are calling and saying, can I get started on these medications? We know from the autoimmune disease literature, it can take up to 12 weeks to get an effect. And so it's really unclear of how quickly these drugs would work, even in preventing the cell from entering, the virus from entering a cell. And so again, that discussion with your doctor, if it's indicated for your underlying autoimmunity, is appropriate. But if they answer no, don't be discouraged. It may be that they just don't think it would be effective. And these medications do have some risk of retinal toxicity. So they're not completely without any adverse side effects. Another medication you may be on is low-dose naltrexone, and low dose is considered anywhere from 1 milligram to 4.5 milligram. And actually, our group had published years ago that we were using this medication for itch, but it's become more commonly used by folks. And one of the people I'd like to highlight that reached out to me was Joanna Harper, who does a lot of speaking for the Scleroderma Foundation. She's a pharmacist, and she graciously suggested that she would be willing to talk to anybody's healthcare provider if they have never heard of this or they couldn't access any articles to support its use, so that she could help talk to the provider about whether it could be used in patient populations who may have immune disease. And again, these drugs are thought to have some immunomodulatory, meaning it affects how your immune system is working and attacking self, but it may also affect how that virus gets into your cells, so have protective effects. And lots of research is currently ongoing to provide you better information and specifics on this. But that brings us to something that I think is critical for staying well, which is food as medicine and eating healthy. And so just remember that your healing tissues, whether you have infection or not, need nutrients to stay well. And where most of our immune system lives is in the gastrointestinal tract. It has the most immune cells in all of our bodies. It is thought that COVID-19 replicates in the GI tract, so a healthy gut becomes particularly important to think about if we're trying to take control over this virus. The majority of your intestinal immune cells have to keep the gastrointestinal tract healthy so it can deliver nutrients. And so the things that you can think about when you're trying to plan your meals is that this includes minerals, carbohydrates, minerals, carbohydrates, fats, vitamins, water, and proteins. There's healthy sources of nutrients in all food types, but what you really want to be able to know is how to plan a meal when you're trying to social distance. And it's important that there's some things you can do proactively, like keeping very well hydrated. There is lots of good data that says adequate hydration is critical for staying well. So while you're at home, making sure that you're drinking enough water is important. Also, decreasing inflammatory foods can be important, and that's sugars. Although a lot of our comfort foods are high in sugar, and snack foods certainly are something that have increased in purchase during the pandemic, I'd encourage our patients to really try to eat healthy. Another common question we've received is, should I be on dietary supplements to keep me well? And remember, a dietary supplement is intended to provide you nutrients that may otherwise not be available in your diet. So we really do recommend, instead of taking a bunch of supplements, try to get that nutrition through your food, through your natural food sources. And again, trying to look into the food delivery options so that you can get healthy food delivered to you. There's lots of questions on supplements in the form of vitamins, minerals, fiber, fatty acids, and amino acids that are beyond the scope of this talk. But there's a good website that the NIH has that I listed here that will allow you to get your frequently asked questions answered by, you can search there for all sorts of information on the natural food sources of these different types of products. Well, what about stress management? And the most important thing about stress is to realize that it's present. And so kind of really taking a good look at when the second you wake up in the morning till the time you go to bed, are you finding yourself that you're constantly having more fear and worry about your health and the health of your loved ones? Are you not sleeping well? Are you changing your eating patterns? Can you not concentrate? And are you noticing that you're really constantly thinking about your health problems? And most importantly, are you finding you're trying to battle this worsening with an increase in alcohol use or tobacco or other drugs that you may have present that are used for pain, but you're finding that you're increasing their use because you're worried constantly about what your health is going to do during this pandemic? And so just realize that the first step to stress management is to recognize it's there. And then the second part is to come up with a management plan. And I liked this diagram because I think this is really how all of our brains are feeling during this pandemic. Lots of information is coming out to us, and we're having more pressure and strain and depression and really feeling this sense of loss of control. And one of the things we can do with a good stress management plan is to instead shift that mind frame and try to take control and say, okay, I'm under stress. What can I do to get control over that? Is that there a hobby that gives me peace? Can I meditate? Can I use yoga? Can I do a walk outside in nature? Can I look at things I have control over, like how I'm going to manage my time, or listening to music, or really therapy options online and or through telehealth, through your healthcare system? You can really come up with a plan to help you organize this stress. And I think that's a key to staying well is there's no doubt we're all getting a lot of information, but how are we going to handle that information and take control? And so some tips from the CDC that I think are all very valuable is taking that break from watching or reading or listening to news stories, and that can include social media posts. If that's something that's constantly making you feel those symptoms of lack of sleep or changing your diet are occurring. And because hearing about something that's upsetting can really affect your health and keep you or put you on a path of unwellness. And so again, one of the ideas that came up through a patient is having that one-aside person to check in with you every night, and that person can give you an update to tell you if there's been changes that are recommendations that are made in your community, but not where you feel like you have to constantly be engaged. Taking deep breaths, stretching, and considering formal mindfulness training can be particularly helpful. Leslie Saketku has done a lovely job with the Scleroderma Foundation of giving you lots of helpful mindfulness training techniques so that you're empowered over your feelings. We've talked about eating healthy and well-balanced meals. We'll touch next how to exercise regularly, but also make sure you're getting plenty of sleep and really start watching how much alcohol, tobacco, or drugs you're using. And if you're starting to find you're increasing your use to deal with your stress, make sure you're cognizant of that and that you don't. And it's really advised that you avoid really all of these products, not only for your long-term health benefits, but particularly during a pandemic, because they can make, when these things wear off, they can make your anxiety level even higher. Take some time to unwind, make a list of things that you enjoy and ensure you're doing them every day. And then connect with others, talk with people who you trust about your concerns, how you're feeling. Remember, you really are not alone. And that's really highlighted with our community today, that everybody, especially the Scleroderma Research Foundation, Scleroderma Foundation, Scleroderma Canada, everybody in those organizations really, really want you to be well and know that message again. You're not alone. We're going to navigate this together. So exercise as medicine is our sort of final topic before we'll move into questions, but something that's really near and dear to my heart. So I have spent the last 15 years of research looking at vascular outcomes in scleroderma. And what we found in our large database is that the best outcomes in scleroderma come from our patients who are exercising regularly. And if you think about that, the blood vessel in scleroderma is sending that message of scarring, and your immune system is responding to that scarring by mounting a response. if we can keep your blood vessels as healthy and happy as possible, patients do better. And this is perhaps an opportunity for all of us as a community to really prioritize exercise as medicine. And even if you're in your home, you can develop a home exercise program that you do daily. And I really like this idea. I had a patient who's getting in touch, and she's doing exercise programs with a bunch of scleroderma friends, and they're doing the program together. And so it really meets three needs. One, they're interacting. She's got a community. Two, they're all getting a good benefit of exercise. And three, she says it's really fun and they spend a lot of time laughing. And I think that's really a critical way to stay well and to get some control over the social isolation that's being implemented. But social isolation doesn't mean stay indoors. Everyone should try to get fresh air every day. So if you walk your dog, you go to the park, you're riding a bike, yard work or gardening, you do continue to do these things, but you try to pick a time when you can easily be 6 feet away from strangers. So again, the social isolation isn't necessarily about not doing anything outside. It is about doing anything outside that puts you within contact of someone who may sneeze or cough on you. But again, that same thing about contact surfaces. Most importantly, whenever you do come back into your home, before you touch anything or eat or prepare food or contact other family members, just wash your hands. So get that hot water, soap, do your 40 to 60 second routine, and then go back to your daily routine. So again, exercise is something that can really keep you well and is critical during this time. So in summary, the most important aspect of managing information is knowing what facts about transmission and how those credible sources of information apply to you. I really highlighted the CDC and NIH in my talk because, again, the amount of effort that goes into making sure that they post things that are truthful are really very diligent. But you'll probably notice there's a catchphrase on all websites that really are dedicated research is we're still learning about this virus. So I think that's really frustrating to a lot of folks is how do you navigate information that seems to be changing all the time and recommendations that seem to change all the time? I think just go back to that idea of looking at good, credible sources of information and asking your physician if it applies to you. Monitor your symptoms and understand how and when to seek help. And that will allow you to really take control. Again, if you have a plan for if your blood pressure is elevated or your Raynaud's is getting worse or you're on immunosuppression and you're concerned about your risk factors of contacts or fever, if you have already thought through these issues and you have talked to your physician and you have a plan, it can feel a lot less daunting. And so again, if that can help you take control of the situation, I hope to encourage you to reach out and do that. Eat healthy. You'll feel better and it will maintain your health. And maybe getting some of these good habits while you're spending more time in your home will continue after the pandemic and keep you well. Acknowledge your stress though, and make sure that you realize that you're not alone and that your management plan for stress can empower you and make you feel better at the end of your day. And lastly, exercise is a very effective tool, not only to help with stress management, but can have long-standing implications for your health even after this pandemic. So it's something that I really encourage everyone on the call to really think through. And again, there's things as simple as chair stretching that you can do that will allow you to keep stretches and breathing as part of your daily routine. So I'd like to conclude there and take the questions and just kind of remind folks that we are really better together as a community. And the systemic sclerosis patients that I have the honor to interact with really are the toughest and most lovely patient population I believe that exists. And so keep supporting each other, keep sharing information with each other. Scleroderma Foundation, Robert Riggs, Scleroderma Research Foundation, Rob Tufel, Scleroderma Canada on the call today, Maureen Sauvé, all have done an amazing amount of tireless work to empower our community. And lastly, just a thank you to the healthcare providers and employees that are working to try to make sure you're well taken care of. I just remind you, folks may be a little bit delayed in their getting their messages back to you. It doesn't mean they don't care. It just means that there's a lot of questions that are coming in. And with that, I see we have some questions. I am happy to stay on later or email responses afterwards, but let's see if we can get through some of your questions.
Fantastic, thank you. So that was an amazing presentation, so informative. We want to turn it over right now to questions. I'm going to turn it over to Robert Riggs and Maureen Sauvé. And Robert, we have a lot of questions. Do you want to take the first one for Dr. Frech?
Certainly. Dr. Frech, many questions came in about proper hand washing and the challenges faced with people who are experiencing digital ulcers and have bandages. So there were numerous questions about that, and I thought as a broad topic we could handle that first. How do people properly wash hands when they're dealing with digital ulcers, bandages on their hands? And a comment was made that they typically use Purell and items like that, hand sanitizers, rather than soap and water, which is in very short supply.
Absolutely. So wonderful question. And if you have access to hand sanitizers, that would be ideal, because as the question is asked, when you take off the bandage and you're exposing that wound to soap and water and drying, that can be incredibly painful. So certainly if you have access to hand sanitizers to clean around the wound so you don't have to remove that bandage, that certainly is preferred. Again, trying to limit a contact with surfaces is ideally the best situation, so that you're not having to continuously rewash. And that means identifying someone who can clean those surfaces for you and help you and assist you. If you don't have hand sanitizer and you don't have access to a hand sanitizer, then unfortunately hand washing does remain the most important way to prevent the virus from spreading if you'd have contact with a surface. And I know that's not the perfect answer. So avoiding contact, washing your hands as few times as you need to because you're not in contact, having someone else clean the surfaces, and using hand sanitizer so you don't have to unbandage those fingers is ideal. And then just remember, the whole reason about your hands is so that you don't touch your face, your mouth, and your nose. So you could also really, if you can't wash your hands a lot, just be very, very sensitive to not touching your face. So that's the transmission. But a very good question.
Okay, that's great. Why don't we turn it over to Maureen for the next question? Maureen, do you want to take the next question?
Absolutely. A question comes in from a patient. I understand that the use of ibuprofen or other NSAIDs may lead to worse outcomes for patients that get COVID-19. Will you please comment?
Yeah, so that is another good question, in that we don't have, unfortunately, we don't have clear recommendations yet. So I would say it's similar to the immunosuppression question, is to talk to your physician of why you're on that therapy and if you can hold it. And for most people, you could likely hold your anti-inflammatories. But the reason that's not a straightforward question is when people are feeling sick, it's the most common medications people are taking. So we're not quite sure what medication recommendations are really, I should say, firm. But if you're on an anti-inflammatory and you're not sick, the question would really be, what is that doing to the cytokine storm? And usually those anti-inflammatories work against prostaglandins. They're not working against those same molecules we were talking about, immunosuppression. So probably, and to be cautious, in most cases it would be safe to stop those medications. But again, I do encourage you to have that discussion, because there may be some other particular reasons that you're on an anti-inflammatory. For example, if you had gout also, and it's controlling the gout flare, and that would prevent you from having to go on prednisone, that would, the NSAID or anti-inflammatory would be a preferred therapy than a prednisone or steroid. So again, everybody should ask their specific physician that question, but my take would be those would be safe medications to hold till we have the information, though I will say that that information is not 100% at this time.
Thank you. Another question came in, evidently that's being asked a lot on online support groups, and that is, there are many people that have SSC that are not on immunosuppressant therapies. Is there any increased risk beyond one's age and current physical condition to COVID-19? In other words, does having an autoimmune disease per se make you more or less at the same risk for complications?
And that is such a good question, because there's many different statements on the credible websites that we talked about that talk about immunocompromised patients. But then there's the statement, well, we're still learning a bit about that information. And it's because the dose of the virus, the genetics, and then how your body's responding to the virus is really how we are best understanding of the severity of this disease. To specifically answer that question, we do not know if someone on immunosuppression is protected. There would certainly be no data to support, if you didn't have an indication for immunosuppression, to start a medication, though the only one that would really kind of fall into that range right now would be the Plaquenil or hydroxychloroquine, because that is commonly used for mild symptoms of joint pain and scleroderma. And so that again is something you could talk to your doctor about. But we really don't know. But I will tell you this, the Scleroderma Foundation set up a chat room for physicians to talk and share information. And so I go on that every day to see if there's an update, to see how I can best educate my patients. And there was a posting from Spain that said that they had had over close to 2,000 cases of COVID at their hospital, that they're tracking very closely the autoimmune disease patients. There was only 44 patients in that cohort that had been diagnosed with COVID. And in their experience, those patients were not acting any different than the general COVID, the COVID in the general population. So that's, to me, very reassuring news for our patient population. Again, it's not published, but this is sharing of information amongst rheumatologists. What do you know? What are you seeing? And so I feel like that was a really helpful for me to say, okay, this is good information for us to say to our patients, while the recommendations are immunocompromised patients should follow all those precautions we just went over in this lecture, we don't have any data yet that caution in those recommendations. We're not seeing anybody with scleroderma having bad outcomes, and hopefully we won't. But again, that's really why the focus of the talk was things you can do that we know works for everyone, because I'd like to think that scleroderma patients will have the same outcomes as the rest of the general population, which is 80% of people have symptoms that convalesce in their home, so that they are not seeing this really severe disease.
Great. I think it's almost noon at California. Maureen, do you want to take the last question?
Certainly. Dr. Frech, there's a number of patients who have expressed concern because they work in at-risk communities, be it in a nursing home or a hospital, and they want to know what extra precautions they need to be taking to protect themselves. Are they more at risk with scleroderma to get the virus, or more at risk for bad disease?
Yeah, so we don't know the answer to that, but that is really where I think it's essential about telework. So if there is, and I agree, because in healthcare, it's hard to know if the rules are changing every day. But the current recommendation would be ask your supervisor if you can do any work from home. And so that would be providing information to patients, doing phone calls from ER visits. So anything that you can do, because your doctor will provide you with a note that says you're immunocompromised, and that should allow you to be able to work from home. However, again, like the last question, we don't know if this is all precautions, particularly because what people are getting sick from is lung involvement. So if you have scleroderma with lung involvement, the absolute recommendation would be to minimize contact with people within 6 feet. So I would say for healthcare workers that have no lung disease, really protecting yourself is the most important. And that if a note from your doctor can help you, or that FMLA can help you, you should absolutely explore those options.
Great, thank you so much. We have run out of time, and I apologize. I know there are a lot more questions. Robert and Maureen and I and Dr. Frech can talk about the best way to respond to some of those questions as well. Thank you all for being on this call. I want to once again extend my thanks to Robert Griggs from the Scleroderma Foundation and Maureen Sauvé from Scleroderma Canada. Working together, we know that we can really make an impact and help provide the information. And of course, to Dr. Frech, who took time out of her incredibly busy schedule in sharing this information up to date as it's coming in and as it's changing. I appreciate all the work you've done. All of our organizations are available to help you. Please feel free to contact us. We will be planning more of these, as I mentioned. And please check back on our websites. We will all have a link to this recording. If you want to listen to it or share it with your family and friends, you'll be able to do that as well. So from California, from Robert's in Florida, and Maureen's in Canada, Ontario, I think, and Dr. Frech is in Utah. From all of us, thank you so much, and we look forward to being in contact.